My name is Megan Bair-Merritt, and I am the Chief Scientific Officer of Boston Medical Center Health System. My role is to provide leadership in our research strategic vision and operationalize that vision such that we are conducting research that really addresses our patients and the country's toughest health challenges. I grew up in North Carolina, although went to Tufts for college and said I was never coming back to Boston because it was too cold. And then in 2013 was down in Baltimore at Johns Hopkins and learned about Boston Medical Center. And it was so aligned with the research that I did, the work that I wanted to do, the populations that I wanted to serve that we moved up here. I became a doctor because I really wanted to be able to work with families and help them achieve their health goals. And, I think for me, for pediatrics, part of what was appealing is getting to take care of kids, but also getting to really partner and work with their parents and their families around holistic health. So my vision for our research is that BMC is really leading the country in interdisciplinary research that tackles our patients and the country's toughest health challenges, all in service to health equity. I think there are important areas of BMC research that people may not be aware of. I think the first is real attention and expertise around how do we ethically and in partnership with communities engage diverse populations into clinical research studies. And so there's really exciting work that's going on at BMC and in partnership with patients to think about, as an example, best practices for enrolling limited English proficiency patients into research studies. And how do you do that in a way that gives people the opportunity to really understand research, to ask questions. And then I think there are areas of real strength where we really lead the country. And, one example of that is substance use disorder. Our substance use disorder really often garners national attention. I think similarly, our work around the impact of health-related social needs on health and well-being, we routinely lead the country in those conversations and in that research. My wish for the future of healthcare is that everybody in the country have access to high quality healthcare that really addresses people holistically. And, I think we have many issues. I think one that's near and dear to my heart and has been the focus of some of my prior research is the separation of mental health and physical health in our system. We think that's a real disconnect and creates barriers and stigma for people seeking help. I am inspired every day by the people around me, our patients who really do incredible things, our staff, our faculty, seeing their thoughtfulness, their kindness, their wisdom is really an inspiration and brings me to work every day.